Hello and welcome to the KPG Healthcare Open Enrollment presentation for 2026, specifically for the external employees at KPG. Welcome. Here's our quick agenda. We'll talk about our new benefit offering and what is self-funding. It's a totally different way that we're going to go about doing this year. We'll talk about UMR, which is a United Healthcare company, but this is going to be a very important company for us to be working with going forward. Our open enrollment timeline, we'll talk about medical, dental, vision. We'll talk about employee education options that you will be receiving, and then action items and next steps. So for our benefit package, we are really changing everything. So United Healthcare is going to be the brand name we're using for medical, dental, and vision. Through our medical plan, it's something called a self-funded arrangement. That means we'll be using a third-party administrator called UMR as our insurance company, whereas our dental and vision will be very traditional dental and vision insurance offered through United Healthcare. So very consistent branding with United Healthcare, but as of January 1st, 2026, all of these things are new. This means if you're currently enrolled and you do not take action, you will lose coverage and be uninsured on January 1st. We don't want that. So what is self-funded? It's a very different and new approach to health insurance. It basically means your employer is now taking on all the risk. Instead of asking the insurance company to take on the risk and paying them all of the premium dollars, all of the money, the health insurance costs, and the insurance company paying for all of the claims, your employer now is acting kind of as the insurance company in this way. So we are going to be approaching this in a very different way. More stability in future rates. So that gives us more control over the costs. We're able to see what's happening with our benefits live. It helps protect us from bigger increases because we're not paying exorbitant premiums to insurance companies and them pocketing some of that as just straight up revenue or I should say profit. Better visibility into our benefits makes us smarter. We can be a little bit better and more targeted with the benefits that we offer. So we can understand what as a company that we are accessing from in terms of health insurance claims, and we can make some changes to our plan to address that and help and be better for employees. Ultimately, if claims are lower than expected, we get to win from that. With insurance companies, they keep all the savings and they call it profit. With the self-insured plans or self-funded plans, whatever the profit is goes back to our benefits, meaning that we can potentially have lower costs in the future. We have more freedom to customize our plans. We can upgrade things faster. We can address certain deficiencies that might be existing in our benefit plan on the fly rather than having to wait till next year to do so. Stronger wellness and support programs, better mental health, very strong telemedicine program, chronic condition care, lower out-of-pocket programs, especially around prescription drug programs. And all of this stuff is really an investment in you. We want a more stable benefit structure. We want coverage to ultimately be more affordable. We want our benefits long-term to be more stable instead of seeing these 15 to 20% increases year over year like most employers are seeing. This is a strategy that allows us to truly bend the cost curve and protecting your wallet, your care, and your long-term well-being. So what is UMR? UMR, I want you to think of it like your insurance company. This is where you're going to start with any questions you have on benefits, on finding doctors, on claims issues, on prescription drug needs or issues. This is where we're going to start with everything. They are going to be our third-party administrator. They are the ones that are in control of our claims and all kinds of stuff. So that's where I want you to start. So getting started with them, the most important thing to note is we want you on the mobile app. Having the mobile app live is the most important thing you can do. This is where you can check your benefits. You can see what you owe, how much you've paid, find doctors, learn about medical conditions, treatment options, all kinds of stuff through the app. There's the QR code right there. Go ahead and download that there. We, of course, need to wait until you get your ID cards in hand. So really getting started with UMR really starts with getting that ID card in your hand. The ID card is the key to all the care. So that's step number one. There's a really great video right here that helps you understand the UMR app. So go ahead and hit that QR code if you want to learn more about that. Once you have that, you'll create your online account. You'll download the app. You'll explore your online dashboard. And if you need any help, there's a customer service number that they are fantastic. They are there to help you. So please reach out to them. More helpful tools and resources. There's a great health education library to learn about. You can sign up for a digital magazine that will come to you. Great articles that can help with any part of your healthcare journey. And then there's a lot of really great resources, QR codes available for all of them. So knowing about your healthcare benefits, how to reduce costs, what's covered in preventative care, how do claims work, understanding your ID card, and then more information on how you file a claim online. So here's your new ID card. I really want to go through it step by step here. So number one is your member ID. This is what your doctor is going to be looking at and going to be calling in and checking to make sure you're eligible in the system. Number two, list all your dependents. Number three is going to be your United Healthcare logo that speaks to the PPO network that you have. Number four, here's your group number. Number five, this is your prescription drug numbers. Lots of different numbers that you need to have available for your prescription drug benefits. You'll find them there. On the backside, number six will be your plan details. Number seven is your UMR care number. This is really only to be used when you need medical services and your plan requires authorization prior to receiving those services. Very important. Number eight right here, this is your customer service number. This is your main number to call for questions on benefits, doctors, claims, these kind of things. All right, so very important to understand the difference between the two of those. And then number nine at the bottom, this is where you will find the prescription drug and membership information number if you're having any issues with that. Open enrollment, this is the time to enroll, to decline, to add dependents, remove dependents, upgrade your plan, downgrade your plan, change personal information, whatever it is, this is your time to do it. And the deadline is Friday, December 12th. Very, very important that you abide by that timeline. We are going to be reaching out to people individually to get you to make sure you understand this deadline and you need to enroll or decline. Qualifying life events, these are issues that happen throughout the year that give you either eligibility to join the plan or eligibility to leave the plan. All right. Because we are using pre-tax dollars to buy our health insurance and our dental and vision insurance benefits, we have to abide by these qualifying life events. If you have one of these events, you can enroll in the middle of the year or you can leave the plan middle of the year. Because you've had some of these events. You want to communicate with your HR department within 30 days of having this event. That's very important, especially the birth or adoption of the child. If you miss this window, you are going to have to wait until open enrollment to make these changes. So if you have any of these qualifying events and you need to join the plan or leave the plan, make sure you talk to HR right away. Who's eligible for benefits? All of you, if you're listening to this, are eligible. So dependent children, biological, adopted, foster children, up to the age of 26 years old. So once they turn 26, the month following that birthday, they will be off the plan. Also domestic partners. But basically everybody at KPG is full-time, so everybody should be eligible. Our key terms to make sure you're aware of deductible. This is the number that the insurance company says you have to pay all of this before we start to pay anything. So the lower the deductible, the less you have to pay out of your pocket before they start pitching in. Copays, these are fixed dollar amounts, $20, $30, $50 that you can use to pay for doctor visits, prescription drugs, urgent care, these kind of things, and your deductible does not apply. Coinsurance, this is the amount that you would pay. You'll see it listed as a percentage, usually 20%, 30%, meaning after you paid your deductible in full, then you're going to pay part of the cost. The insurance company pays part of the cost, okay? And that, again, percentages. And so when you see 20%, that means after your deductible, you pay 20%, they pay 80%. And then out-of-pocket maximum. Once you paid a deductible and your co-pays and your co-insurance, once you hit this out-of-pocket maximum, you pay nothing else the rest of the year. And the plan pays 100%. So your out-of-pocket would be zero at that point. And then premium, this is what you're paying on a per paycheck basis for the membership to the insurance policy. This is what gets you invited to the party so that you got the deductible, the co-pays, the co-insurance, and if you have the major events, you've got the out-of-pocket maximum that protects you so that you're not paying anywhere over, I think, $5,000 to $7,000 for the year. Preventative care, just a quick reminder, these are $0 co-pays. This is something so critical for all of us to be reminded to get our annual physical exams handled. This is a great way to make sure that they catch things early so they can be treated so it doesn't become an expensive or problematic healthcare issues. So make sure you're taking advantage of preventative care. So our United Healthcare plans, they've got primary care providers, but you do not have to choose one. They're specialists. You're going to be part of the United Healthcare PPO network. So a lot of things we just discussed. Here's the three medical plans we have available to us. And on the right, we have our per paycheck benefits. So you'll see as you go up in deductible, you go down in cost. And all of our PPO networks are using the United Healthcare Choice Plus network. So we've got a $500 deductible with a $4,500 out-of-pocket maximum, a $1,500 deductible with a $5,000 out-of-pocket max, and a $3,500 deductible with a $7,000 maximum benefit. So all of these plans give you copays for regular doctor visits, specialists, urgent care, prescription drugs, all of that before meeting the deductible. After your deductible, you are going to pay the percentage you see here for these services, not to exceed your maximum out of pocket. Different types of care for different types of issues. So convenience care clinics, doctor's offices, urgent care, emergency room. You want to make sure that you avoid that emergency room unless you are having a true medical emergency. Otherwise, find urgent care. Or I'm going to really recommend using our Teledoc program, which we're going to look at here very quickly. Right here, speaking of it, so we've got our Teledoc Health and our Teledoc Primary 360. Very important, very good stuff here. So Teledoc, this is a phone number to call to talk to anybody, anytime, anywhere. Experienced medical doctors, behavioral healthcare experts. You're usually waiting less than 10 minutes to talk to someone. Everybody in the family has access to this. You can even have them send pharmacies, prescriptions to the pharmacy of your choice. So lots of different things that you can be treated for here. I recommend you look into Teledoc. Really, this should be your number one stop for any medical services. Now, the primary 360 is actually an advanced benefit here that we've got where you can choose a primary care provider and schedule a phone or video visit at your convenience. You can go through anything you go through on a primary care visit. This is great for those of you that don't have time to go to a doctor, that aren't sure you're doing everything you need to do, that want to take the healthy steps. Or maybe you have a history of family chronic conditions and you want to make sure that you are on top of them so that they do not become the chronic condition that you've experienced with other family members. Other benefits we have, emotional well-being services through Optum, fantastic benefit. This is going to help you with anything from anxiety to depression, elder care support, getting a lot of that nowadays. Legal or financial concerns, parenting, family issues, workplace conflicts, work-life balance, marital issues, drug and alcohol abuse. All of these things you can look into and get 24/7 care for free. So please look into this service here. Also through Optum, the Optum RX benefits. So this is fantastic. You can check drug prices. You can get home delivery care. You can save tons of money by getting these prescription drugs delivered straight to you. Prescriptions are making up so much of the cost of what we spend medically throughout the year. So any opportunity to save money is a good one. Please take advantage of this, especially for those of you who have regular prescription drugs. You can get them sent home, automatically refilled, or you can find a network pharmacy to go to. Speaking of medical RX, we've got an additional program. This is for those of you who have very high out-of-pocket specialty prescription drugs. All right, so this is someone that will reach out to you. If you qualify, they will contact you directly, but this is really when you get specialty medical drugs that are specialty drugs that are very expensive. These people help you one-on-one, contact manufacturers, find copay assistance, find different ways to find the same prescription drug for far, far cheaper. So can help you know exactly what you can expect to spend, and they can save you sometimes thousands of dollars a month. We've seen it happen. I've seen it even more. Someone has to pay over $1,000 a month for the prescription, but you can get it for a $10 copay through the manufacturer copay assistance program. So good stuff there. Another thing for those of you with maternity on the mind, the care program that is available through UMR can provide comprehensive pre and prenatal assessments, pre-pregnancy and prenatal assessments, lots of educational information. Really good place to start for those of you that are going to be going down the parenthood journey. Very, very helpful information here from these guys. quick information here. This will be really a lot of this information is about you being able to go back and find this information later on. Most of your medical claims are going to be submitted directly through your provider, but in case they are not, this is the way you would go about doing it. When you need to file it, you got to get the provider tax ID number, the CPT codes of the services. A CPT code, of course, you guys are on the medical field, you should probably know, but these are the codes that insurance companies use to display what the benefit was. Diagnosis codes, receipt for services, data service, and the description of service. So good piece of information here in case you find yourself in need of this. We've got dental plans too. We got a dental PPO plan. This is a preferred provider organization. This means you have a national network of providers that are available to you. It's a very good plan. You can see on the left what your per paycheck cost is going to be for these plans. It is a $2,500 per person calendar year maximum. That means once they've spent $2,500 on you, you are paying 100% after that. There's a $1,500 per person lifetime orthodontia benefit. And then you'll see for diagnostic and preventative services, they cover 100%. For basic services, they cover 80%. And for some of your major services like crowns, inlays, dentures, some of these things, you're going to get it's going to be a 50-50 split there as well. Here's a little more information on accessing your dental ID card. Really always recommend going to the app. That's where you're going to find it, but you can print it. They are not going to send you one automatically. I recommend you go in, you download this dental ID card so you have it on your phone so you can use it if and when you need to. Again, the app for United Healthcare. This is just for our dental and vision plans only, guys. This is not for your medical plans because we'll be using UMR for all of that. So make sure you download the United Healthcare app so you can look into your dental and vision benefits. Speaking of vision, we've got a vision plan. Vision coverage is very important. So much of your medical health can start and can be indicative of with what's going on with an eye exam. So please think about the vision coverage. It's very inexpensive. You get a comprehensive eye exam for $10 once a year. You get a $25 copay for lenses once every 12 months. And for frames, you have a $180 allowance every 12 months. And if you need contact lenses instead of your glasses, you get that benefit every 12 months as well. So very good vision plan from United Healthcare as well. Again, with your Vision ID card, you can do that through the app or go to myuhcvision.com. This is also where you will locate providers. So really good information here once you're into this site. Again, a little bit more information on the vision plan. You can go to myuhcvision.com to find a provider. There's a phone number there for you. A lot of the brand name network retailers are out there for you. Costco, Lens Crafters, Optical, Sam's Club, Walmart, Warby Parker, 1-800-CONTACTS, all of these brand names are there for you. Again, a reminder, just the dental and vision plans will be using the United Healthcare app. As we wrap up, you will be part of an educational campaign that comes through emails. We will be sending you information on a weekly basis. Please, if you're not that interested in them, you don't need to read them, but they are there for your help. Please do not ask to be unsubscribed. We do try to send out very useful information for you and to you. This is all helpful. We are not selling your information to anybody. We are not spamming you. We are trying to help you better use your health plan, medical plan, dental plan, and we'll be looking out for you to do so. There's an employee benefits microsite for you at your fingertips. It's at eb3.com/microsite/KPG. You're going to find all kinds of information here, a quick little video from me introducing you to the site, contact information for us there, member resources for all these different benefits that we've got available to us. A fantastic place, a good place. If you've got general questions on everything that's going on, this is a great place to start. This, as well as we talked about calling UMR, but this is where we're going to list a lot of the documents that I went through in this presentation for you to review. So action items, we need you to find out if you're going to enroll, research your providers, choose the coverage and complete and submit. The deadline is Friday, December 12th, everybody. Please, please, please understand that, and please use that deadline to your advantage. You will be hearing from us. If you have any questions, if you need any answers, we're here to help you. Thank you so much for your time. It's an honor to be your broker, and we're here to help you should you need us. Thanks so much.